A middle-aged patient presents with rapid onset, usually unilateral painful proptosis with diplopia. CT scan shows tubular configuration of extraocular muscle enlargement. So most likely diagnosis will be orbital pseudotumor, thyroid eye disease, orbital lymphoma, rhabdomyosarcoma. Answer of this question will be orbital pseudotumor. Non-specific orbital inflammation or orbital pseudotumor is also known as orbital inflammatory pseudotumor. It is the most common cause of the painful orbitopathy in adult. It is defined as benign or non-infectious process of the orbit without identifiable local or systemic causes. So this is diagnosis of exclusion. You have to exclude true neoplasm, primary infection or any systemic disorder before putting the diagnosis of orbital pseudotumor. Most commonly this involves extraocular muscles, then it can involve retroorbicular soft tissue, sclera, uvea and lacrimal gland involvement may be there. This is the third most common cause of orbital disease after thyroid eye disease and orbital lymphoma. So most common DD of this pseudotumor will be thyroid eye disease and orbital lymphoma. And this tumor may mimic like primary tumor like rhabdomyosarcoma, lymphoma. So you have to exclude primary tumors, thyroid eye disease and orbital lymphoma. The etiopathogenesis of this disease is unknown. Patients commonly present with an abrupt onset of diffuse or localized periocular pain, which is associated with diplopia and restricted ocular mobility. And swelling and redness of the eyelid can be seen as similar to the orbital cellulitis. Histological picture is variable, ranging from diffuse polymorphous cellular infiltrate to the non-granulomatous inflammation with infiltrative sclerosis. And there are diffuse mononuclear cell, lymphocyte, plasma cell, which are spread in the fibrovascular tissue. Orbital pseudotumor, there is enlargement of extraocular muscles with tendons, which lead to the tubular configuration in the orbital pseudotumor. While in thyroid ophthalmopathy, there is muscle enlargement while the tendons are not enlarged. That configuration may lead to the spindle shaped configuration in the thyroid ophthalmopathy. This orbital pseudotumor is highly responsive to the systemic corticosteroid treatment, and steroids are established primary treatment of orbital pseudotumors. Other treatment are radiotherapy, cyclophosphamide, methotrexate, cyclosporin, and rituximab. In some cases, surgical interventions are required to rule out any other primary pathology like primary tumor, infection, or any lymphoma. So, biopsy is needed in doubtful cases. Sometimes surgical intervention is also required if this mass or tumor is expanding. So in that case you have to do surgical decompression.